The time is 21 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm sure the week that has been has allowed us all to inspect on every symptom that it could be yours or it could be that of your loved one that has to do with gynecology, which the doctor would very well be able to assist with. It's time to consult. It's time for our open line of female health. Our resident gynecologist, Dr. Maluleke, is here, and that means it's time for you to start sending through all of your questions. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send us a voice note to 060-771-5107, 060-771-5107. There's also the option of giving us a call. This is the number you can dial.
Have your say. Call us now on
015-151-1058. 015-151-1058. That's the number to dial. Doctor, good evening. Welcome.
Evening, Rebecca. Good evening to our listeners.
Are you well, Doctor?
I'm very well. How are you?
I'm well, thank you. Let's briefly talk about endometriosis. It's something that we certainly will not stop talking about tonight. It's something we've spoken about as well previously. It keeps coming back into the public domain as a lot more people also add on to the conversation by just giving awareness around it. I saw somebody was talking on social media about people normalizing having heavy menstruation, for example, that comes with a lot of pain, to say that such things need to be spoken about. But talk to us about endometriosis, Doctor, perhaps as though we've never spoken about it before. What is it, and what do we all need to know and understand about it? When should one go look for the possibility of consulting to see if they could have endometriosis?
Right. Endometriosis is a condition whereby the normal lining of the inside of the womb, what we call endometrium or endometrial lining, is now found elsewhere outside the womb. Commonly, this lining or the tissue that we are talking about will be found on the tubes themselves, on the ovaries. It can be on the peritoneal, which is the covering of the pelvic area. But sometimes endometriosis or this tissue will find itself in on some other internal structures, such as the intestine, such as the liver. Sometimes you will find women having a lump on the belly button, and this lump typically would become painful or even bleed when they menstruate. Sometimes this lining can be found in the bladder. It can be found in the rectum. Occasionally, it can go as far as the nose, wherein people would have a nasal bleed. When it's in the bladder, when you menstruate, you also pass blood in the urine. And when you pass stool, if this is in the rectum, you'll also pass blood in the stool. That is endometriosis. Now, the theory behind it is that under normal circumstances, a woman sheds this lining when she's menstruating, and the lining has to be passed through the cervix, and it is menstruation. Now, the theory is that with endometriosis, there is some degree of backflow of the blood into the tubes, then into the peritoneal cavity. Now, in the majority of women where this happens, the body will get rid of the blood. But there is a smaller group of women where this blood then becomes active. It adheres onto the structures in the pelvic area. And as the woman is menstruating, she will also experience a lot of pain during menstruation. The type of pain that you experience is what we call secondary dysmenorrhea. By that we mean it is because you've got a condition in the pelvic area that will then lead to you developing the period pain. The kind of pain we are talking about here is the one that starts a couple of days prior to the flow of the blood. That is the one symptom of endometriosis. The other symptom would be painful intercourse. Very, very painful, particularly deep or penetration. what we call deep dyspareunia. This is the kind of pain the women will experience. Thirdly, the majority of women with endometriosis will also struggle falling pregnant. It's not very easy for them to conceive. Some of them will actually need assisted reproductive techniques so that they conceive. Then there is a huge group of women who would experience what we call chronic pelvic pain, as opposed to the period pain. The period pain is cyclical. You experience it at the time of menstruation, whereas chronic pelvic pain will happen at any time throughout your cycle. And these are women who are debilitated. They suffer pain, chronic pain, and unfortunately, Rebecca, this is the kind of condition that will be there throughout your reproductive career or reproductive life. You may find relief when you reach menopause. But because of the nature of the condition we're talking about here, some women will actually be subjected to some form of surgery even before they get to the menopause. This is endometriosis. Last month it was endometriosis awareness month.
Yes.
This month, did you know, is hysterectomy awareness?
I didn't know.
It is hysterectomy awareness. We should actually touch a bit on that.
Yes, we should.
Because it's also a major problem that is afflicting women who end up losing their uteruses, so that they are made aware about the reasons why women end up losing the uterus and what are the consequences thereof. We need to talk about that at some point.
When one has been confirmed to have endometriosis and it leads to them going to surgery,
Right.
what would be happening in that regard, and what purpose then does going to surgery bring about?
Surgery has got two important reasons. The first one would be relief of symptoms, all right? And the second one would be to improve fertility, all right? So remember that we had said earlier that the people who get this are the women in the reproductive age. Therefore, the majority of them would still have a desire to reproduce. So when we operate on such women, we're going to remove the endometriotic lesions. Sometimes the majority of women will present with what we call chocolate cysts. These are ovarian cysts. When you puncture such a cyst, the lesion that or the liquid that comes out looks like chocolate. So we go and remove cysts such as those, or remove the other lesions that will come because you've got endometriosis, or that will define the presence of endometriosis. Sometimes you get patches, and these patches will range from being brownish to even greenish, sometimes reddish. Some of them will be whitish. So you get a variety of patch or scarring in the pelvic area as a result of this lesion, or this condition rather. So we go and remove such lesions. And some of these lesions, sometimes it behaves like cancer in this way, that it is invasive. You know, cancer starts from one area, then it invades the underlying structures. Endometriosis does the same. So when we operate, sometimes we are forced to do very radical surgery, what we call pelvic clearance. Pelvic clearance would be in those women where reproduction is no longer feasible, and we feel or we think that the only way for them to be relieved of the misery is to remove all the reproductive structures. That means removing the uterus, removing the tubes, removing the ovaries themselves. Unfortunately, this is what might be necessary in some instances.
All right. I'm in conversation with our resident gynecologist, Dr. Maluleke. We're talking all things female health. Join us in conversation with your questions and comments. Our WhatsApp text line is 079 295 1212, 079 295 1212. Or send us a voice note to 06077155107, 06077155107, or you can give us a call. The number to dial is 015 151 1058, 015-151-1058. We continue with this conversation after the break.
Have your say. Call us now on 015-151-1058. Conversations with Rebecca Pala.
Why we continue to see these protests, especially in a time like this where the country is headed towards local government elections.
Who are these people who are protesting? The very same people who protest are not free agents that are available for each and any political party that want supporters. No, they already have their own prefixed electoral attitude. And more than 95% of them, they've got their preferred political party. But they are protesting because of false promises. They say, no, politicians so and so made this promise to us. Voter behavior has got very little to do with community protest, because even if tomorrow we can say election day, the very same people, when they vote, they will vote for their preferred political party. By protesting, it doesn't mean that those committee members are switching their political allegiance. No.
Conversations, Mondays to Thursdays, 6:30 p.m. to 8:30 p.m. with Rebecca Pala.
Looking for a self-catering lodge in Tweefontein, Polokwane? Haven Springs offers family vacations, conference hall, entertainment, large corporate group events, stockful meetings, birthdays, weddings, and accommodation. With Haven Springs, you can braai, swim, and enjoy our free Wi-Fi. Haven Springs, Utilivu, Safi. Rest, rejuvenate, release.
Taku Confectionery makes customized cakes for all occasions: anniversaries, birthdays, baby and bridal shower, corporate, weddings, you name them. Not forgetting scones, muffins, cupcakes and biscuits. Enjoy from the first bite. Taku Confectionery also offers professional cake baking and decorating lessons. Taku Confectionery is based at number 5 Oleander Street, Flora Park. Call us on 082-486-6288 or visit our Facebook page at Taku Confectionery. Taku Confectionery, deliciously baked for you.
Enjoy free rides with Leeto La Polokwane. Leeto La Polokwane is finally here. Get on the bus and enjoy a free ride between Polokwane CBD and Seshego, Polokwane CBD and Flora Park, Polokwane CBD and Westenburg. Take a selfie and share your first travel experience with #JourneyWithUs. Offer valid until the 10th of May 2021. For more information, contact Leeto La Polokwane on 015-023-0055, WhatsApp 068-554-4235. Follow Leeto La Polokwane on Facebook, Twitter, and Instagram, or visit leetolapolokwane.co.za. Leeto La Polokwane, journey with us.
Conversations with Rebecca Pala.
The time now is 8 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm in conversation with our resident gynecologist, Dr. Maluleke. We are talking all things female health. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212. Our voice note line is 060-771-5107, 060-771-5107. And if you would like to give us a call, the number to dial is 015-151-1058, 015-151-1058.
Say, call us now on 015-151-1058.
All right, doctor, let's listen to a voice note. Doctor?
Irritation on the vulva during intercourse. Well, there could be a number of reasons. Firstly, if they are using protection, the woman could be reacting to the material that the condom is made from. We have a huge problem now of latex allergy, which is the material used to manufacture condoms and also examination gloves that doctors and nurses use in the hospitals. There is definitely a latex allergy out there. So that could be one reason. The other reason could be that she is reacting to the semen or of her partner, because there are people who develop allergy to the semen, the protein content in that semen from the partner. And this would also translate into poor reproductive function. Women who tend to have recurrent miscarriages because of the incompatibility that might be there between the partners. So those would be some of the reasons. But we had said on numerous occasions that thrush is actually one of the commonest reasons why people may feel irritated, and thrush is very, very, very common. Although it's not a sexually transmitted infection, it is a fairly common infection which is hormonally mediated and may lead to irritation during intercourse. Other skin conditions, such as lichen planus, these are autoimmune conditions. They may also lead to that sort of thing happening.
Okay. Good evening, Rebecca and Dr. Maluleke. I've been noticing that whenever I menstruate, the first 2 days are fine, but on the third day, I will experience itchiness and some swelling around my vagina. I tried even changing the sanitary towels I use, but it still comes. But when I finish with my menstruation, the itchiness goes bit by bit. Should I be worried?
Not necessarily. We had said on numerous occasions that thrush would manifest around the menstrual period in some women. Some others would experience it before, and some after the menstruation. And in this instance, she is experiencing it towards the end of a period. And this is something that is recurring, which indicates to us that this indeed is a hormonal activity. So she will experience that. If it's troubling her enough, she can use the ointment that is available, but this ointment is for external application on the labia themselves, and that will give her some form of relief.
Good evening, Rebecca and the doctor. I have one question for the doctor tonight. I was on duty today, and a colleague of mine told me that his wife, for the first time in 2 years, just saw her periods over the weekend. So, doctor, I would like to know, is it possible and why is it happening? This is from John Tlati.
Right. If you have been without a period for 2 years, by all intents and purposes, you have been menopausal. That is menopause. The absence of periods for a period of 6 months is, by definition, menopause. So if you bleed afterwards, we then call it postmenopausal bleeding. Then we worry because you are bleeding when you're not supposed to be bleeding. We worry. There are quite a number of reasons why you can get postmenopausal bleeding, but we worry mainly about cancer, commonly cancer of the cervix. Occasionally, it could be cancer of the uterus itself, or what we call endometrial cancer. So, she needs to go as early as tomorrow to report this to her doctor, who will then examine her, and among other things, he will do a pap smear if at the examination he does not see an obvious lesion. But if there is a lesion on the cervix, instead of doing a pap smear, you'll take a tissue, what we call a biopsy, and sends it to the lab, which will then tell us what actually is happening there.
No, right. Anonymous says, good evening, I'm 8 months pregnant and I always feel some stomach pains or stomach cramps, especially when I take a walk or when I'm sleeping. What might be the problem?
She's experiencing what we call Braxton Hicks contractions, which I usually say this is the womb's way of preparing itself for the big day. The simple example I give is that, when you watch soccer, you will see there are players on the bench. And these players, before they are given an opportunity to start playing, they warm up, all right? They warm up. The uterus does, in simple terms, more or less the same kind of thing. It's preparing itself for that day. So, unfortunately, it will be a bit uncomfortable for some people, but it's not a dangerous condition. It's something that most pregnant women can live with.
Okay.
Yeah.
Anonymous says, good evening. What is the percentage of precision in sauna? For my wife, my wife has been to 3 sonas, all performed by different doctors respectively. Each and every one has detected its figures in terms of pregnancy weeks, which do not collide at all. Would you advise on that?
Right. It is an important question that we have to address. Firstly, the accuracy of ultrasound depends on the person doing the ultrasound, all right? And there are levels here. There are people who have had the most basic form of training, whose skill enables them to diagnose the pregnancy, perhaps also to date it, all right? And then there are others who will go beyond those basic skills. Among other things, they will be able to locate the placenta. They're able to calculate or estimate the amount of like, or they're able to even identify the gender of the baby, and so on. Then you've got the most advanced ones, who will then, in addition, pick up abnormalities, even the most subtle abnormalities, on ultrasound themselves. They will be able to tell you if your baby has a problem. Then there are the ultra skilled ultrasonographers. These are the ones who can even perform operations on the baby when the baby is still inside. So the accuracy, therefore, will depend on the skill. Right, that is the first thing. Then the second thing is the duration of the pregnancy itself. The best accurate examination is that which happens earlier on. As the baby grows, we have what we call the margin of error. And this margin of error becomes wider as the pregnancy progresses.
Okay.
So if I see a patient for the first time in the 3rd trimester, I'm not likely to be accurate on sonar. This is why we also have to ask the patient the last menstrual period, because we are able to calculate the duration of the pregnancy based on that. If you are sure about your dates. Unfortunately, many people, when they fall pregnant, they then think backwards. Oh, I have missed my period. So when was the last one? And unless, of course, you've been trying to fall pregnant actively, this also is fraught with mistakes. You're asking someone to think back, and it's not often easy for people to think back. But then we take the history on the menstrual history that I'm talking about, then the examination. We palpate on the abdomen, and then the last one would be sonar. We take all three, and then we're able to come to as close as possible to what is likely to be the period of gestation. But then there is also the issue of the machine itself and the software that is used. There are people who have come up with softwares that we are using to time the pregnancy, and they differ from one person to the other. And therefore, it's not surprising that when she comes to see me, I'll tell her this, and when she goes to somebody else, they'll tell her something else. But the variability or the differences between us must not be very wide. But the margin of error, in other words, when we talk of margin of error, it says, for example, if you are around 34 weeks, it will say you are 34 weeks and 3 days plus minus 3 weeks and 2 days, something like that. So it could be 34 weeks minus the 3 weeks, or 34 weeks plus the 3 weeks. So it gives us that kind of scenario.
Okay, let's go to voice notes now. All right, we've dealt with that. I think this question came, you'd remember we dealt with it last week?
Yeah.
Yes.
We had said the commonest reasons why there is a smell in the genitalia is bacterial vaginosis. All right? Maybe one needs to explain what we mean by bacterial vaginosis. Bacterial vaginosis is a result of the changes in the normal environment of the vagina. The vagina, just like the mouth, is full of bacteria. And most of the bacteria is good bacteria, what we call the flora. You know, the flora is the organisms that exist in a particular environment. When we talk of the flora of Kruger National Park, for example, we're talking about the animals that are located in a particular habitat, right? So we have the flora in the vagina. We have the flora in the mouth. We've got flora in the intestines as well. Now, this flora or this bacteria will maintain the health of the vagina. And among other things, the vagina then becomes an acidic environment wherein the pH ranges between 3.5 to 4.5. Now, because of hormonal activity, the pH tends to rise. When the pH is beyond 4.5, then you've got an overgrowth of other bacteria, right? And these bacteria then will start to release certain chemicals. And these chemicals are much more released during menstruation and also during sexual intercourse, which is why the man might detect that there is a smell when he wants to have intercourse with his woman. These are known as amines. And the amines typically will give a fishy smell or rotten fish, if you like. And that is typically how bacterial vaginosis will present. Right. Because it is a hormonal thing, and the hormones are there all of the time, one can be treated, and at some point it will come back. All right. There is treatment for it. The significance of bacterial vaginosis is largely noted during pregnancy. When you are pregnant and you've got bacterial vaginosis, you run the risk of having a miscarriage, you run the risk of having preterm labor, you run the risk of having ruptured membranes, and therefore delivering the baby prior to the time that you are supposed to deliver. Occasionally, they say it might lead to pelvic inflammatory disease, but it is not a sexually transmitted infection. And therefore, when we treat the woman, it's not necessary for the man to be treated. It can be treated sometimes because we're talking about the pH and the health of the vagina. Instead of you taking antibiotics for it, you can use probiotics, which are tablets that are available over the counter. You are taking these tablets, incidentally, when we say probiotics, they contain the good bacteria that you can take to reconstitute the health of the vagina. It can also be taken, this can be taken also by women who have thrush, and also people who are suffering from chronic diarrhea. They can take probiotics to reconstitute the situation in their organs.
All right. Let's listen to more voice notes. Doctor?
The yeast infection that we just talked about, or Candida, or Monilia. And these are some of the names that are used to describe this infection. Now, yeast is also, or Candida, is also there in some people's genital area without it causing any problem. You can pick that up sometimes when you do pap smears. Right. Now, she says what causes it. There are a number of reasons why people may get thrush. One of them would be when you're pregnant. Very, very common during pregnancy. To further emphasize the fact that the hormones have something to do with this. Two, when you take the pill for contraception, one of the side effects of the pill would be the thrush. 3, if you are treated with broad spectrum antibiotics, you will find that one of the side effects you develop is thrush. 4, it might indicate that you do have elevated sugar in your blood. Sometimes sugar diabetes presents in this fashion. Number 5, if your immune system is suppressed, your immunity is not working very well. There are a number of reasons why immune function might be affected adversely. Some of the medications that we give, certain diseases, infections such as HIV, sometimes will lead to you developing poor immunity. And when you have this, this is why when thrush is recurrent and maybe resilient, we urge women to be, or people to be tested for HIV. Could be one of the reasons why thrush is recurrent. Number 6, during, or I've actually touched on this earlier on, prior or after menstruation, some women will know that their period is due because they will then develop the thrush around that time. Number 7, there is a practice known as douching. Douching is when women take a bath and they want to cleanse the vagina. Yeah, they clean the vagina. There is nothing wrong with cleaning the vagina. The problem is what you use to do so. We urge people to use just water or perhaps with a bit of bath salt. The moment you use all these intimate washes that smell very good, you are actually disturbing that environment that we touched on earlier. And you will find that thrush becomes a problem. And number 8, one of the reasons why you can develop thrush might have to do with the kind of underwear that you put on. The tight underwear, which you will get when you have nylon or silk underwear. We used to teach, and we still teach, that thrush thrives in a dark, warm, and moist area. When you have tight underwear, you actually create that environment. Darkness, warm, and moist, thrush will grow. So the advice, therefore, is that you need to use cotton rather than silk or nylon. Okay? She asked about food. Yes, if you tend to eat sugary food, you will encourage the growth of thrush. And we had said in the past, and we'll still say it again, that the natural yogurt which contains the bacteria, what we call the lactobacillus, seems to be beneficial in some instances. Sometimes you can even put it in the vagina itself. You will find that you recreate the normal environment and thrush becomes less of a problem. But because it's a hormonal thing, it is likely to recur. Right.
All right, let's go to a lot more of the voice notes.
Implant. So I just wanted to ask if it will affect me in the future if I still want to have children, because sometimes I feel pains, sharp pains where my ovaries are situated. So I'm scared if maybe there might be something wrong with me, or I don't know. So yes, I would like to know about that, if it's normal or...
Should she have waited? She's asking if she should have waited.
I didn't hear at the beginning of her voice very well, but I heard something about the implant.
Let's just play it again.
Yes. Correct. Right.
So that's essentially the gist of it.
Yeah, no, now I heard what she's saying. She had an ectopic,
Yes.
and soon after she used the implant as a form of contraception. And she wants to know if this will have an impact on her ability to have babies in the future.
Yes.
Right. Firstly, we would have loved to know what was done at ectopic pregnancy. Did they cut the tube? And or they repaired it? And what about the other tube? These are the things that we discuss with patients afterwards. If you have had an ectopic, the first thing we come to tell you is where was the ectopic? On which side of your reproductive structures was the ectopic? 2, what did we do? Did we cut the tube? Or the tube was damaged such that we couldn't salvage it? Or we were able to remove the ectopic and repair the tube? These things will have an impact on her ability to reproduce in the future. But assuming that the other tube is normal, right? Assuming that at least one tube is normal, her chances will be good of falling pregnant. There are many women who will have babies even with one tube. The worry, though, that I have is that she was given the implant after the ectopic. There are certain forms of contraception that we want to avoid because they tend to increase the recurrence of the ectopic, namely the intrauterine device and the injection and or the implant. For some reason, they tend to increase the chances of women getting an ectopic if they are to fall pregnant. So we would like to avoid those forms of contraception. We would rather urge her to use the pill or the condom. You must have, once you have had an ectopic, avoid using the loop and avoid using the injection.
So she should immediately change her contraception.
She should change her form of contraception ASAP.
Hi, Dr. Rebecca. Last month, I did not understand my period because I went for 1 day and it stopped and came back after 2 days. I received more blood, like the whole of the week. Please help. This is from Maria at Baledi.
Once again, we would want to know if she's on any form of contraception and if this is just a once-off kind of thing or it has happened before. All right. Now, listening to her question, she says last month. Perhaps prior to that, things were normal.
Yeah.
Now, the teaching has always been, once there is any change in your period, which you are not used to, pregnancy becomes the most likely reason. Any form of disturbance of your period might be so because you are pregnant. And often, when you are pregnant, that which you call the period is not even normal. It's not what you're used to. If she had experienced this sort of thing for the first time, she should worry about the possibility of her being pregnant. If she's not pregnant, then it suggests that there was a poor functioning of the ovary in that cycle, which might just be an isolated thing and is not likely to recur. But pregnancy must be excluded.
Okay. I'm in conversation with Dr. Maduleke. We are talking all things gynecology, and this is how you can get in touch with us if you would like to ask your gynecology-related questions. Our WhatsApp text line is 079-295-1212, 079-295-1212, or send us a voice note to 060-771-5107, 060-771-5107, or call us on 015-151-1058, 015-151-1058. We will deal with a lot more of your questions after the break.
Have your say. Call us now on 015-151-1058. Shh. Ashifa Breakfast.
Araribana mapungwa nevatamaricha toverera kana wasara muragu. Vangarumira muraidzo WhatsApp kana voice note kana nombori ya 064-879-6128. Ubva update center. Nandikati Phi Emmanuel Gwinda. Kabe machironi abudi. Nda.
Bokwinda.
Nda.
Mr. Say, I don't understand Shivenda, ne? And I like the part where Bokwinda says, I'm reading it as is, right? Vakotobe Boko Shara Mora. Oh, what does it mean, Tim? Sepo Thoniel. Sepo is on the line.
Sepo, Yeah, meaning that if you have any news alert that you feel this is newsworthy that you can follow, therefore you can alert us via the number that we announce after that particular statement.
Oh, all right. Yeah, I know. Now I understand you. Thank you very much.
Ashifa Breakfast, Monday to Friday, 6 to 9 a.m. on Energy FM and Choice FM.
If you don't know, now you know.
Choose Boxer, where you save more. When you buy Rama Original 70% fat spread bread, 1 kg, buy 3 for only 109 Rand. Danone Inkomazi full cream mask, 2 kg, buy 3 for only 60 Rand. Choose Boxer, where you save more.
Looking for a ride? Get your ride now. T-Drive. By simply downloading the app now on your Play Store. And get up to 100% promo code valid for 12 months. We guarantee you 100% safety and affordability. Follow us on Twitter and Instagram at T-Drive7, or simply visit www.tdrive.co.za. T-Drive. Follow us on Twitter and Instagram at T-Drive7. T-Drive.
Are you an established or an aspiring artist in the music industry? Queens of Heart presents Masterclass on Music, Crafts and Arts. This amazing opportunity will give you the resources to gain knowledge on an overview of the music industry and its key players, different types of royalties and how to get your music on radio, copyright law and general principles of contracts. The event will take place on the 8th of May 2021, time 8:49, venue at the Jack Waters Hall, but it will also be live streamed RSVP on this email, queensofheartssa@gmail.com.
To Thursdays, 6:30 p.m. to 8:30 p.m. with Rebecca Pala.
The time now is 21 minutes past 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. We are in the middle of our engagement with our resident gynecologist, Dr. Maluleke. We're talking all things gynecology, and to do this, we, as always, ask you to send through all of your gynecology-related questions, and this is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212, or send a voice note to 060-7715-107, 060-7715-107, or you can give us a call.
Have your say. Call us now on 015-151-1058.
All right, let's go back to the voice notes now, Doctor.
Hello, doctor. I experience severe period pains, and like 2 weeks before my periods can actually come, I experience swollen breasts, and they become so shiny and very painful. Is that normal? And even though I can take some tablets like Brufen, Nurofen, still they don't work. What could work better, and what is the cause of it all behind?
Doctor?
Right. Starting with the issue of the breast would be what we call premenstrual syndrome, PMS, which is a hormonal thing, and not an easy condition to deal with, by the way, PMS. People have come with all sorts of things, some of which are herbal in nature, and they differ from one person to the other. So it's difficult there to advise what would be best for her. But the period pains, according to what I heard, she seems to be having the secondary variety, which we talked about a bit earlier on.
Yes.
This would, when we say secondary, it's because there is a problem either on the womb itself, on the tubes themselves, and on the ovaries themselves. On the uterus, you could be having fibroids, commonly. On the tubes, you could be having tubes that are blocked and you've got collection of fluid, what we call a hydrosalpinx or hydrosalpinges. You've got fluid in the tubes. And you could be having also ovarian cysts. Commonly here, we're talking about endometriotic cysts, what earlier on I referred to as chocolate cysts. These would then give her the kind of pain that she's having. The reason why this variety doesn't seem to respond to medical treatment is precisely because you're not dealing with the root cause. You're not dealing with the cause. If you have a fibroid, you must treat the fibroid. If you've got an endometriotic lesion, you must deal with the endometriosis rather than just to take pain medication for the period pain. And this will recur until you actually go and remove what is the cause of the pain. This is what she needs to have.
Okay.
Right.
Voice note.
Right. I think I would not worry if I were her, because remember, the uterus was a bit enlarged, and therefore it needs to get back to normal. And for it to do so, there will be contractions, and the contractions will give the kind of pain that she's experiencing. The bleeding also, just like if you have delivered a baby, you may bleed for quite some time until things normalize. And we often say things are back to normal at 6 weeks after the miscarriage. The fact that she has seen a normal period now means that indeed things are back to normal and there's nothing to worry about.
Okay. Another one.
Well, Tateon today decided to send a voice message.
A trend.
I see we've got more voice messages than calls. Maybe it's cheaper this way
I think it's convenient as well.
To send a voicemail. Right. Vaginal pain, according to her, it's sudden and makes it difficult for her to walk. One can only speculate. But sometimes it might have to do with the positioning of the cervix, and also translates to the position of the womb, because certain positions of the womb will lead to the cervix being in an unfavorable condition, and it can give the kind of discomfort that she is describing. But we can only verify that at examination. If she is to go and be examined, then we'll tell her if there is reproductive structures are in their normal position or they are shifted, if you like. One of the reasons why you can get this kind of pain as well would be prolapse. Prolapse, as we said some time ago, as you give birth to babies, there is a laxity of the pelvic floor muscles, and the uterus, together with its structures, tend to fall downwards. And that's what we call prolapse. And this will give vaginal pain, sometimes accompanied by lower back pain. And this discomfort, incidentally, when you wake up in the morning, you're not feeling anything. As the day progresses, you tend to feel the discomfort much more, because necessarily during the day you are on your feet, and the force of gravity is pulling the structures downwards, and can give you the discomfort as is described here.
Okay, another one.
After 6 weeks, I went to check up. I did pap smear. The results come back that I was diagnosed with low-grade squamous intraepithelial lesion. And then the recommendation was colposcopy or repeat after 4 to 6 months. And then the code, it was written ICD-10, which is mild cervical dysplasia. And then the doctor recommended that I must go to theater so that they can ban, I forgot the procedure, but they ban those abnormal cells and they remove tissue on my cervix and take it to the lab to check if it's cancerous or non-cancerous. Okay, after the result come back, everything was fine. I was not feeling any pain at all, even though the result shows that I've got a problem on my cervix. After I did the procedure on the 30th of November. From this, I've been experiencing some pain on my cervix. And then yesterday it was worse. I went to the doctor and then he checked. He said he's suspecting a cyst. He's seeing something like a cyst, but he's not 100% sure. So I have to go to the lab to do some tests. And then I think it's about 7 tests, just that I'm not holding the paper. But 2 of those tests is insulin and glucose. So I want to know, how does it relate, the glucose and insulin, on a womb, or let me say a cervix problem? Because I don't know, I'm not a doctor. I don't understand why are they doing those 2 tests. The others I understand.
That's a very thorough question.
Very thorough. And I think I have an idea what the doctor was thinking. Well, she has had what we call colposcopy and LETs because of the abnormality that she had on the cervix. This is where we take someone to theater and we examine the cervix using a machine known as a colposcope. And colposcopy is the procedure that is done. This machine then magnifies the cervix, and then we apply certain chemicals on the cervix, and we then remove areas that look abnormal. The tissue that is removed is sent to the lab. The lab then gives us a report. Right. And according to her, the report, a repeat pap smear said there was no problem. Now, she's got pain, and since she had the procedure, the possibility is that she might have had an infection of the cervix. Because remember, after the procedure, there's a wound there. There is a raw area. And this raw area, obviously, is amenable to infection. That could explain the reason why. Now, when she went back to the doctor says there might be a cyst. Now, the fact that the doctor is thinking about doing insulin and glucose, which is sugar, and insulin is the hormone that regulates the sugar. The doctor is actually thinking about polycystic ovarian syndrome. Okay? He's thinking about the polycystic ovarian syndrome, and he wants to make the diagnosis on the basis of the test that he has done. He would probably have done, among other things, the follicle-stimulating hormone, the luteinizing hormone. He'll have also done the testosterone, which is the male hormone. And that's why she's saying about 7 tests have been done. So the doctor is actually in the process of trying to exclude the possibility of polycystic ovarian syndrome, which is a condition that we have touched on numerous occasions. Right.
Doctor, that is our time. Your contact details, please.
We are in Polokwane, 72A Compensati Street, 015-295-9407 or 295-9419.
Our next appointment is next Thursday. Thank you very much, Doctor.
Thank you and good night.
That is all the time we had on Conversations for the week. Thank you very much for always lending us your ear and interacting with us whenever we ask that you weigh in on whatever matter that we're discussing. A big thank you also goes to the show's technical producer, Emmanuel Quinda. We'll do this again on Monday evening. Bye.
All day, every day. We keep the hot songs coming all day long. On Choice FM.